Hello, everyone. Well, we are back again talking about women 40 and above. This topic is supplements. We know our estrogen and progesterone is going down, our cortisol is probably going up. All those things are happening in our bodies. So in our bodies to supplement to make sure that we are not nutritional deficient. Well, that's the topic today with Dr. Jones. Dr. Jones is a doctor of acupuncture and integrative medicine. Welcome.
Thank you. Thank you so much for having me, Amita. I'm happy to be here. I was thrilled when you guys reached out because this is a topic that is near to my heart and something that we work with a lot. So I'll start with just maybe a quick rundown of who I am and what I do, and then I'll jump in with this wonderful topic. So yes, my name is Dr. Meritt Jones. I am the founder and clinic director of Natural Harmony Reproductive Health here in San Diego, which is an acupuncture and integrative medicine clinic specializing and really dedicated to reproductive health and fertility. And we happen to use supplements a lot within our practice. So I have a lot to share. Before I do, though, I wanted to just touch on a couple of quick housekeeping items, I guess, if you will, around supplements. The first one is, I think this is important to say that supplements are a wonderful tool. Again, we use them very often. And I think it needs to be said that supplements in and of themselves, there's no magic pill. Really, supplements should be used in combination with nutrition strategy and lifestyle support for best results. They're really meant to be used kind of synergistically. And then also, I just want to say, of course, that yes, I am a doctor. I'm not your doctor, unless I am. If you're a patient at Natural Harmony, then fantastic. But otherwise, the information here is meant to be educational. I welcome questions. But if you want to start taking something, please talk to your doctor about it. So with that, let's jump in. I wanted to focus first and foremost on resveratrol, which is one of my favorite supplements, and I think it's become pretty well known. Resveratrol is a polyphenic compound famous for its antioxidant support, and probably actually most famous for being found in wine, right? Whenever we talk about it with patients, that's the first thing they say, oh, I can get that from wine, right? So, well, yes, yes, you can, but the truth is the amount of wine that you would have to consume to get the therapeutic dose of resveratrol would put you in the hospital with alcohol poisoning before you would reach that dose. So, which is not to say don't drink wine. Wine is a wonderful part of many cultures, can bring a lot of joy. That's great. But as far as getting resveratrol, it's not the best source. And so let's talk about what is resveratrol used for. So again, resveratrol is a polyphenic compound found in wine, found in other foods, grapes, of course, chocolate, peanuts, but to get the therapeutic dose, you do need to supplement. And what we use it for, I think it's most well known as a kind of an anti-aging supplement, which it is. And the reason that it can help with that is that it's an antioxidant. And antioxidant support reduces inflammation and supports mitochondrial function, which is really a fancy way of saying that it helps with cellular health. And cellular health is the foundation for all aspects of reproductive health, especially as we age. And so the way that I use resveratrol and the way that our practice uses resveratrol, really, we use it usually for four primary issues. The first one, and one that I think it's pretty well known for, is for fertility and egg quality, especially in women over 40. Resveratrol, again, helps with mitochondrial function, which helps with cellular health, and egg cells are cells. They're cells that require a lot of antioxidants. And so supplementing with a therapeutic dose of resveratrol can help to improve egg quality. And so that's definitely one way that we use it. a caveat there, there's some research saying that resveratrol may not help with implantation. So if you're actively trying to conceive and you're using resveratrol, you'd probably want to just use it in the first half of your cycle, and then after ovulation, discontinue. Another way that we use it is with PCOS. We work with a lot of patients dealing with polycystic ovarian syndrome, and it can definitely help in a couple of ways. It helps to reduce androgen hormones, which are those quote unquote male hormones that can really interfere with hormone function in folks with PCOS. And it can also help to lower insulin levels, can help with insulin sensitivity and insulin resistance, which is important for ovarian health in general. So using resveratrol to lower insulin levels can help to promote more regular cycles and healthy ovulation, which ultimately is the name of the game when we're trying to balance hormones if you're still cycling. That said, it can also be used for those of us who are not cycling, for folks who are in perimenopause or menopause. Resveratrol is helpful because it's a mild phytoestrogen, and it's anti-inflammatory. So it can support, for those of us headed into menopause, it can support cardiac health. It can help reduce the risk of breast cancer. It can help with cognitive health. So helpful for the spectrum. And then the last condition that we often use it for and that we work with a lot is endometriosis. So a couple of years back, I did a deep dive into all of the research. I was working on a project centered around endometriosis, and resveratrol just kept coming up as a supplement that really kicked butt, if you will, it kicked Endo's butt. So it really helped with estrogen metabolism for folks who have any kind of estrogen sensitive condition, which endometriosis is. It's not, the root of endo is certainly not hormonal, but it is highly estrogen sensitive. Taking very gentle, very mild phytoestrogens can help with estrogen metabolism, and it can help to reduce inflammation. And there were actually some studies supporting that resveratrol in particular could actually help to shrink endometrial lesions, which is really significant and pretty cool. So those are the 4 ways that we use resveratrol in particular, most of the time in our clinic. And just to kind of summarize how resveratrol in general can help with hormones, I'll go over that and then talk about how to use it. And then we'll talk about other supplements that can also help. So as a summary for how and why we use resveratrol, it's an antioxidant. It can help with fertility, it can help with endometriosis, it can help with PCOS. Because it's a mild phytoestrogen, it can help with estrogen issues. It can help with estrogen that's too high. It can help with metabolizing that estrogen. It can also support folks who are in menopause or perimenopause with balancing estrogen levels. Can lower androgen hormones, which is why it's helpful for PCOS. It can help with insulin sensitivity. It also helps, I don't think I mentioned this, but it can help with thyroid hormone support, which for women over 40, for people over 40, is really often overlooked and really important, because as we start to age and our hormones start to shift, thyroid can sometimes go a little haywire. So just another reason to consider resveratrol. And again, it can help with breast cancer risk, which again, as we get older, becomes more of a concern. As far as what to look for in a resveratrol supplement, you would want to look for trans resveratrol, the most bioavailable, most active form of resveratrol. And you would want to make sure that it's professional grade. Supplements as a whole it's not a well-regulated industry. And so you do need to be mindful of where you're getting them from. Usually through providers, professional grade supplements are usually found through providers. We're going to be opening up an online store to make these products more accessible to folks, because they are wonderful, they are powerful, and they're not always easiest to access and good quality. As far as how to take it, Resveratrol is pretty gentle. You can take it with or away from food. I usually like it with food. The standard dose is between 500 and 2,000 milligrams a day, just depending on what you're using it for. I thought it would be helpful also to just talk a little bit about when not to use it, because as with all supplements and medication, it's certainly not appropriate for everyone. So if somebody has bleeding disorders or is on blood thinners, that would be a no-go because it is a slight blood thinner. If you have an estrogen-sensitive cancer, that's also a time when you wouldn't want to use something like this, at least not without talking to your cancer care team. I think those are the two big ones for now. There's some information about how it might interfere with some drug metabolism, but the information on that is limited. And hopefully you'll be talking to your doctor before you started it anyways. Let's see. And then I guess one thing I wanted to mention is if you're digging around about just trying to learn about resveratrol, you'll probably come across trestilbin, which is another supplement very similar to resveratrol, potentially more bioavailable, but there's not a lot of research out there yet. So if you're doing your homework, trying to find which type of resveratrol supplement is going to be best for you and you come across this trestilbin, you can consider it. Some of the supplement companies are now combining resveratrol and trestilbin, but for now, we typically still recommend resveratrol just because we have a lot more info about it. So with that, I think I'll move into other supplements to support women's health, unless Anita, you have questions about the resveratrol.
No, I think you covered it very beautifully, very detailed, and at the same time very succinct. So we want to focus on women 40 and above. What are the supplements that women should consider when they are going to start hitting perimenopause and menopause? Just you don't have to go in a lot of details, but just on a very high level, is that something that they can do also? Yeah.
Absolutely. I mean, resveratrol is definitely at the top of the list for all the reasons that we hit on with the estrogen support, cardiac support, cognitive support, all of that. And as an antioxidant, antioxidants in general work best in symphony with other antioxidants. They can support each other. And so there is definitely a long list really of antioxidant-based supplements that can support people over 40 and women over 40, absolutely. I'll give you my top 5 to start, and then I will welcome questions if that's helpful. One of my very favorites to support healthy aging, to support women over 40 as they're moving into menopause or as they're preparing for, IVF or egg quality support or whatever it is, N-acetylcysteine, which you'll probably see most often abbreviated as NAC. It's an amino acid that is a precursor to glutathione, which is one of the body's just yummy, most favorite antioxidants. So it's really helpful for hormone health, really helpful for egg quality support, sperm health even, N-acetylcysteine. And a standard dose for that really depends. You can go as low as 600 milligrams all the way up to 1,500 or 2,000. Generally best taken away from food. But truly, if I had to pick one of my favorite supplements, resveratrol would be at the top of the list, but NAC would be right there with it. It's wonderful for women's health. Another one is inositol, which is particularly helpful for ovarian health, especially as we get older. Inositol can help with insulin sensitivity, which is a common issue as we head into our 40s. And insulin sensitivity or insulin resistance becomes more common. A supplement like inositol can help to just kind of tilt the scales in your favor to help keep your ovaries functioning optimally for as long as they can, and to just help with the smoother transition. Standard dose for that would be between 2,000 and 4,000 mg. But you'd want to work up to that. It can be a little hard on the tummy, so you'd want to start probably at a lower dose and work up. what's another one? Coenzyme Q10, probably most famous for supporting cardiac health in women over 40 and really in general for anybody over 40. But it's also become a well-known supplement in the reproductive health world because it can help with aging, it can help with egg quality for our patients over 40 who are going through IVF treatments or looking to just optimize egg health. CoQ10 is always on the list. We see a lot of reproductive endocrinologists recommending this one as well. The standard dose for this for fertility is between 400 and 600. You could go up to 800 milligrams for women's health and hormone health in general. And I think that's actually probably in combination with resveratrol, one of my favorites to support women over 40 just because of the cardiac support. So along with hormone health and just generally reducing inflammation, it can help with cardiac health, which is an important topic as we get older for women. And then as I was digging, I found a little bit of info about how melatonin and resveratrol together can be particularly supportive for women over 40 for cognitive health. So as our estrogen and progesterone start to decline, it's very common to hear about brain fog or just cognitive decline. And melatonin, usually a lower dose, probably between 2 and 5 mg, in combination with resveratrol, can be really supportive of just easy, smooth transition into the second half of life. And then I think I'll wrap up with one of my most favorite, easily accessible supplements is a good quality fish oil, high EPA, DHA fish oil. And that's just going to help with everything. It's a helpful anti-inflammatory, helps with brain health, helps with hormone health. It is a mild blood thinner, so you want to be careful if you're taking blood thinners. But other than that, fish oil is probably one of those that I think almost everybody could take and have benefit from. So I think I'll wrap up with that. If you have questions or if you want to open it up for questions, I'm happy to take questions at this point.
Sure. Yeah. So most of the women that I talk to, they have a problem with hair loss, hair thinning, So is there any supplement? I mean, of course, the diet is important. You talked about the phytoestrogens and all that, right? But is there any supplement that women should take specifically for hair fall or hair thinning? That would be the question I get a lot from women.
Yeah, anything that's going to support estrogen balance and androgen balance. So a lot of times as we head into this perimenopause land, we see an increase in androgens and a decrease in estrogen and progesterone. And that's one reason that we get this hair loss. So actually a lot of the supplements that we already covered here, resveratrol would be great for that as a mild phytoestrogen. The inositol, which is going to help with androgen metabolism and insulin resistance is definitely going to help. There are certainly other androgen metabolizing supplements on the market. The two that we use most often would be EGCG, which is a green tea extract that can help to gently support androgen hormones and will help with hair loss potentially. There's a couple of reasons that we would say hair loss, but that hormonal shift is a common one. And then the other one that's stronger that I wouldn't recommend using without really talking to a provider and getting your hormones tested, but it is a potent supplement, is saw palmetto. And that can really help to keep those androgens balanced. I would recommend using it if you're heading into menopause, probably with something to support those estrogen and progesterone levels. Yeah.
Well, yeah, no, that's a very comprehensive list that you shared. I think that most of the women have asked these questions, so I wanted to bring these questions on supplements. Of course, as you said earlier, proper nutrition is so important. Not only when you're pregnant or earlier, but towards our later years, as we start aging. So supplement is only, supplement, but the nutrition is very important. Anything, last words, anything, Dr. Jones, that you would like to share your practice or anything that you want to say before we wrap up today?
Yeah, I mean, I just really appreciate you being here. We would love to connect with folks. You can find me on Instagram at Dr Meritt Jones, or our clinic is Natural Harmony Health on Instagram. We're NHRH Integrative Fertility. We have an amazing team of 5 doctors, and we just love what we do. So I would love to connect with y'all. Please find me. And thank you again, Amita. This was really fun. I appreciate the invite. So.
Thank you. We are launching programs for women 40 and over in a couple of months. We are partnering with global experts and bringing you all these workshops so that you can start taking care of yourself with a holistic way. There's no one magic pill, as Dr. said. There are multiple things. You have to fundamentally change your lifestyle, and that's what we're going to help women do that systematically. With that, thank you so much. Thank you, Dr. Jones, for helping come here